Taking the InBody test. Wipe your hands and feet with an InBody tissue. The InBody tissue will help enhance your body's conductivity. It is recommended that the examinee lie down for about 15 minutes before the test. Take the right leg touch type electrode labeled RL. Foot electrodes should be positioned between the examinee's ankle bone and heel. Take the left leg touch type electrode labeled LL and repeat the process. Place the arm and hand flat on the bed. Take the left hand electrodes labeled LA middle and LA thumb. Clip the LA middle electrode on the left middle finger. Then clip the LA thumb electrode onto the left hand thumb. To start the test, use the touchscreen to click on the ID section. Input your preferred ID and press enter. Then put your weight, height, age, and gender. Using the keypad, you will be able to choose which type of electrodes you are using, as well as what position the examinee is testing in. If you are testing a dialysis patient, click on dialysis mode and check off the necessary boxes. Press enter to start the test. Your InBody results will print automatically once the InBody test is completed. It's recommended to test every 2 to 4 weeks in the same condition to monitor and track your progress.